So we're going to start with the head and neck. You can stand or sit. I'm going to squeeze my fists, sit up nice and tall, press my feet into the ground if possible. Straight back, starting with the neck and then working my way down to the head and toes. From here, I'm going to bring the chin down, rotate, bend, extend back, rotate, bend, and flex down. One more rotation, bend, extend back, rotate, bend, flex down. Rotate the other way, bend, extend back, drawing a circle with the chin. We're going to do one more circle. Think of your chin going around the clock. Each rotation is a little bit bigger, and you want to make sure that you're not going into any pain. Okay? So there's open and closing angle pain. So if you feel pain here when you bend to this side, this is closing angle pain. This would be open angle pain. It's okay to have some stretching and some tension on your open side, but if you have some crunching or any type of pain on this side of the joint, then that is an issue that you want to work around. So you don't want to push deeper into that end range. Okay? So be aware that you don't want to move into pain. You want to go around the pain, and you want to think of this as low intensity, 30% max. Okay? So we're going to go with the thoracic spine. I'll give you a side view. You can do this on a chair or standing or kneeling. All these positions you can do standing, kneeling, or sitting. So I'm going to sit up nice and tall and bring my chin into my chest, so keep it locked. I don't want to be moving my head. I'm not rotating my neck. And then from here, I'm going to just flex my thoracic spine down. Keep my hips where they are. I'm going to rotate. And then I'm going to bend into the side, extend back, rotate the other way, bend into the side, and flex down. I'm going to keep rotating, bend, extend back, rotate, bend, flex down. Okay, I'm going to rotate the other way, bend, extend back, rotate, bend, and flex down. One more rotation, bend, extend back, rotate, bend, and flex down. From here, we're going to go with the shoulders. We're going to start with the scapula, and then we'll work our way to our glenohumeral. So our scapula goes up, down, forward, and back. So we're going to keep the elbows glued next to the side as close as possible, whether we're standing, kneeling, or sitting. And then we're going to go up, keep the elbows touching the ribs, back, down, forward, up, back, down, forward, up, back, and down, back, up, forward, and down, back, up, forward, and down. And then our glenohumeral, or our shoulder here, we're going to flex up. Other hand is going to be squeezing here. We're going to bring the arm over the head, and then from here, we're going to internally rotate or turn the bicep forward and bring our whole arm forward, rotating it inward once we get to our end range, and then reaching back, squeezing the bench or chair. Keep internally rotating so the back of the hand is next to the side. Now you might feel your scapula going up here. Make sure it's set in a neutral position. We're going to extend the shoulder, externally rotate at the shoulder, reach all the way back, all the way up, across the body, and down. One more. Flex all the way up, internal rotation, all the way to extension, and then extension, external rotation, all the way to flexion across the body and down. Switching side, flexion, internal rotation all the way to extension, back of the hand next to the side, extension, external rotation all the way to flexion. Trying to keep your head in line with your spine here, trying to not let anything else move but the shoulder. Flexion, rotate, back of the hand, rotate it inward, and then we're going to rotate outward as we reach back and around, all the way up, across, and down. Good. For our elbows, we're just going to extend our elbows first with a supinated elbow so I can see your palms. And then we're going to flex the elbows, pronate or turn down and push all the way down. And then I'm going to flex, rotate, extend. Flex, rotate, extend. Flex, rotate, extend. And then we're going to rotate, flex, rotate, extend. Rotate, flex, rotate, and extend. Good. For the wrists, you can put your hands on your knees, or you can just bring your elbows next to your sides like this. What we're going to do first is do a wrist check, seeing how good of wrist extension you have. We're looking for straight fingers, and we're looking for a flat line here. Okay, if you don't have a flat line here, or if you're a little off, you might be a little bit tight in here in the forearms, or you might need to do more of these wrist cars. So we're going to go ahead and start. We're going to extend the wrist down, standing, kneeling, or sitting. Okay, hold here. Keep our elbows glued. Nothing is moving. We're not going like this. We're not internally rotating the shoulder. We're not externally rotating the shoulder. We're not flexing and extending or supinating the elbow. So just moving that wrist. So the fingertips will go down, in, all the way up, out, all the way around, down, in, all the way around and up, up, all the way around and down. Other way, all the way around and up, up, in, all the way around and down, down, out, all the way up, up, in, all the way down. Good. Okay, so there's your wrists. Now we're going to perform our hip and move our way down to our lower body and then work our full spine. So if you're seated and you can't go to the hands and knees or stand up, this is what you're going to do for this exercise. You're going to place one leg across the knee here, and you're going to just sit up nice and tall, and you're going to feel a stretch in this hip. Okay? So that's one option that you can do. If that doesn't work, what you can do is you can externally rotate and internally rotate the hip, just like this. Okay? And you'll switch sides when we switch sides above. Okay? You can do that on both sides. Now, if you're standing, you'll need either a wall, or what you can use is the ground. So I'll show you the ground version, and then I'll show you the standing version. So what I'm going to do is go to the ground, flex the knee to the hip, open up the hip, rotate all the way around to extension, extension, abduction, external rotation, then out, all the way around and back, knee to knee, back, all the way around, forward, and down. You can do that on the same thing on the other side. Knee goes in, or hip goes into flexion, abduction, internal rotation to extension, and then extend all the way around, forward, and down. Back around, all the way around and back. Back, all the way around, forward, and down. Okay? So that's one version. Now, if somebody has bad wrists, or if their wrists don't feel good, that's going to be very hard for them. Okay? So you also have the option of doing it standing. Okay? So using a barrier like a wall, and then using that same or that opposite side, going up, out, internal rotation, all the way to extension, back, out, all the way around and forward. Okay? You can do that same thing, other side, up, all the way around, and back, back, all the way around and forward. You can also do it on the hip on that side closest to the barrier. Okay, so you have all those options. And then probably the easiest option, if you are able to get on the ground, is to be able to do that while you are on the ground like this. Okay, so those would be the hip options for hip cars. Okay, and then switching. So you're getting a little bit extra hip if you're following along. But it's good to know the different variations depending on who you're going to be teaching this to, or if you're doing this yourself. All right, so for the knee and the ankle and the toes, we'll go back to our seat. You can also do this standing, or you can do this seated on the ground. Okay, so you can push into a wall and bend your knee and turn your leg like we're doing. It would look like this. So you just hold on to a wall, bend the knee, turn out, extend, turn in, bend. But we're going to try it with the chair. Okay? So I'm going to hold on to my leg. I'm going to bend the knee as much as I can. I can, if I want, just hold on to the table or the bench. I'm going to turn the foot out, really squeeze that hamstring, extend, turn in, bend, turn out, extend, turn in, bend, out, extend, in and bend. Now we're going to stay in, extend, out, bend, in, extend, out, and bend, in, extend, out, and bend. And then switching. Okay, out, extend, in, and bend, out, extend, in, and bend, extend, out, bend, in, extend, out, and bend. Okay, for the ankles, you can hold on to your shin, you can do that, or you can just point the toe out. Okay, so we're going to point the toe down first. We're going to go draw a circle in and up, up, all the way around, all the way down, back to your start. In, up, all the way up, around, all the way down, in, all the way up. Let's go the other way, all the way around and down, out, all the way up, in, all the way around, and up, up, all the way around and down. Switching side, point the toe down, in and around and up, up, all the way around and down, in, all the way around and up, up, all the way around and down. Other way, all the way around and up, in, all the way around and down, out, all the way around and up, up, all the way around and down. Good. For the knees, they have to be totally relaxed. So while we're seated here, everything's totally relaxed. You can do this seated on the ground, or you can also do this standing up. Okay. So as long as this leg is totally relaxed, we're going to push the kneecap side to side to start. Okay. If you're standing, it would look like this. If you're seated, it would look like this. Okay? So we're going like that to start, and then we're going to push the kneecap around in a full circle. Okay? This is the only car or controlled articular rotation that we're going to do that is passive. Okay? All the other ones were active. So we're passively pushing the patella around in a full circle. Okay? We're not looking for pain, we're just looking for movement. Okay? Let's go ahead and switch side, about 3 to 5 circles each way. First, push it side to side, and then up and down, and then all the way around. Okay, you should have the ability to passively push that patella all the way around 360. If not, you just have to think about your setup. If your knee's slightly bent, that can be an issue. If you're putting tension on that quad, that'll be an issue. And if you're putting pressure, a lot of pressure on that leg, you're not going to be able to do this. So go ahead and switch side. Make sure your thumbs are together. Okay, try not to like push one way and then push the other. Try to work the thumbs in unison here. So that's the patella car. All right, for the toes, you can do this standing or sitting. I'm going to bring all 10 toes on the ground to start, and then I'm going to kind of flex those toes into the ground until my feet kind of lift off the ground. Since I'm sitting here, I don't have to worry about balancing. I'm just going to squeeze those toes nice and deep and hold 5, 4, 3, 2, and then relax. All toes off the ground, and we're going to separate the toes. So we're going to separate the toes, hold here, keep holding, keep holding, keep holding, and then we're going to bring all toes down, and then all toes up, and then try to separate them, and then separate them, try to have your feet and toes separated as much as possible when they land. Try it again one more time. Separate them, and then push them on the ground. Try to get them as separated as possible. The goal is to get your toes as far away as possible, and also to get your big toes toward the midline and not going laterally. Okay? So the midline is closest to the midline of the body. So we want those toes to go straight up. We don't want those toes to go near the neighboring toes. Notice that this toe here goes closer than this toe does. So I'm kind of trying to think about those toes going up at the same time, so putting them close together, and then trying to lift up those toes together and holding. 5, 4, 3, 2, 1, and now all toes up. Now this time just the big toe down, small toes up, hold, 5, 4, 3, 2, and then switch, small toes down, big toes up, hold, 5, 4, 3. You might have to really get over your legs so you feel, try not to let this go off of the ground. So try to keep this part of the toe on the ground here, don't let it go off. Hold, and then switch, big toe down, hold, 5, 4, 3, 2, and switch, hold, 5, 4, 3, 2, and now we're going to piano it down. All toes up, piano at pinky, all the way to big toe. All toes up, pinky, all the way to big toe. One more, pinky, all the way to big toe. All toes up, big toe touches the ground. 1, 2, and 3.